Hi, Dr. Bobby Stanley here with Stanley Institute. Today, I want to talk to you about 5 ways to avoid no-show appointments. We know that there's a huge financial loss when a patient does not show up in an office. On average, 10% of appointments end up being no-show appointments per week for U.S. doctor offices. So if we're seeing 30 patients in a day, that's 3 no-shows, which doesn't sound like a lot, but over a course of a week, if you work a 5-day week, that's 15 patients a week that do not show up. So how much is this? Well, if they're 1-hour appointments, how much is your 1-hour appointment worth? And then when you multiply that times 15, that number becomes really large. As a matter of fact, over the course of a doctor's career, a 40-year career, 10% no-show rate can equal up to $6 million. That's $6 million that you don't have to put in your pocket to help with contributions, to help offer free dentistry. $6 million is a lot of money. So what is a no-show appointment? A no-show appointment is when a patient fails to appear for a scheduled appointment and fails to notify you. Now, it may also be a patient who notifies you, but they don't give you enough time to fill that appointment. For instance, if you have a 48-hour cancellation policy, a no-show rate could mean that the patient canceled in under 48 hours and you're not able to get somebody in that appointment. So we want to make sure that we can avoid that. So let's talk about ways that we can avoid that. First of all, appointment reminders. Doctors, if you're not doing appointment reminders in your office, you are so far behind times, and it's so easy to do. In the old days, we did it with postcards. Today, almost everything is digital. So patients could get emails, they could get text messages. It's so easy. 95% of patients say that text messaging is much more convenient than getting a voicemail. So you having an employee who's spending their time on the phone calling patients to remind them of their appointment, those days are gone. We can automate text messages. And what happens when a patient gets a text message? When the phone buzzes with any of us, when our phone buzzes with a text message, we usually will immediately lift the phone and look at it, or we'll look at our Apple Watch and see who's texting us. If we don't, we're checking those text messages at our first convenient time. So text messaging is definitely the way to go. The second thing, scheduling management. So you want to schedule these patients as close to their call as possible. So if you have a patient who called in today and said, I have an issue I want to see the doctor about, and you say, well, I don't have an appointment for 3 months, that patient is much more likely to either go to another office or they're more likely to forget their appointment. So we do not want to put those appointments out. I realize that you may be busy. I realize that you may not have open spots. You might want to hold some spots for last minute call-ins, especially new patients. You always want to have somewhere for a new patient to go into your schedule in the next week. So I would hold openings in doctor schedule, hygiene schedule for new patients to go in within a week. If for some reason those do not get full, surely you have other patients who can fill those. So don't ever worry about that. Also, avoid rescheduling patients. So when you're managing your schedule and you're looking at your schedule and you're like, gosh, I didn't mean for this schedule to look like this. And you call patients and you say, I'm so sorry, I have to reschedule your appointment because I didn't realize I booked you beside somebody else and we're not going to be able to do that. Or the doctor's going to be out, or it's not convenient, or our office is going to close and we didn't know. Anytime you reschedule a patient, that immediately shows them that you're not valuing their time and they may not value your time. So please be careful. You want to keep regular office hours so patients know when you're open and they know when they can come in. You do want to make it difficult for a patient to reschedule, however. So if a patient calls and says, I'm so sorry, I can't come to my appointment tomorrow, I need to reschedule. Obviously, people have busy lives. Obviously, things come up. We want to understand that and be respectful of that, but we also want our patients to be respectful of our time. So you want to make it more difficult for them to come in. So the last thing you want to do is say, Okay, well, we have an appointment tomorrow. You want to take that one? Or fine, we have an appointment next week. I mean, you want to say something like, I'm so sorry, Mrs. Jones, that you can't make your appointment. We've held this time specifically for you. Is there any way possible you can make that time? Or maybe you say something like, I'm so sorry you can't make your appointment tomorrow. Do you mind if I ask what the emergency is? Because obviously, if you're canceling within 24 hours, there must be an emergency. If the patient is canceling within 24 hours or within 48 hours or whatever your office policy is, then fine. Just ask the patient to reschedule several weeks out. I'm sorry, Mrs. Jones, we don't have anything available for you until 3 weeks. Is there any way you can keep your appointment tomorrow? Oh my gosh, I didn't realize 3 weeks. Yes, let me keep that appointment. The next thing you want to do is make sure that you have a no-show policy. It needs to be a written policy, one that you stand by at all times. Obviously, people get sick, their kids get sick. Sure, we can waive a no-show appointment or a no-show fee, but we're only going to do that one time. We're only going to do that one time. So if a patient does call in and they have a legitimate reason for not being able to show up, or they call back and they say, I'm so sorry, I didn't mean to miss that appointment, we will give you mercy one time, but we let you know that you're only allowed one time. We need to charge for our no-show appointments, and that's our point number 4. Make sure that there's a charge. If you waive the first time, great. There's nothing wrong with that. Let the patient know that, I'm so sorry you couldn't make it. We certainly understand that things happen. However, we do have a no-show policy, and we'll waive this first time for you, but next time there will be a charge. And you establish what that charge is. It could be $100 an hour. It could be $100 for every 30 minutes. But it needs to be something that's established and something that you stick by. The last final thing, which is number 5, is prepayment. This one is really big, and that's why I held it till the end. If you can offer your patient a prepayment discount, Mrs. Jones, I know you need to get that crown done. We're going to go ahead and schedule you. And if you could pay for that today, I'll be happy to give you a 5% discount or a 10% discount, whatever you feel is important. And Mrs. Jones may say, oh, I love a discount. Yes, let me pay for it today. Patients don't have a problem paying in advance, and you simply need to ask. Why would we do this? Because when a patient has paid for an appointment, they're less likely to miss that appointment. So please ask your patients to prepay for their appointment. So this is 5 ways that you can help your patients avoid no-showing for their appointments and keep your schedule full. If you want to learn more about keeping and expanding patient relationships within your practice, check out this video here.